Thank you, Pamela and Laura. Um, Welcome, everybody. Tonight, I'm going to be talking about Medicare basics, everything you need to know, and as quickly as we can possibly get it crammed into your heads. So Pamela already kind of discussed the mission of the Area Agency on Aging, which is to work with our communities to find programs and develop systems that keep people in their homes as they age. I am the coordinator for 9 counties in Colorado for the state health insurance program, the SHIP program. This again is a federally funded program that's designed to provide free, unbiased information and education and advocacy on all things Medicare and anything that could be potentially related to Medicare. All counties in all states nationwide have access to a SHIP program, at the very least by a statewide free number. I have listed both our local Colorado Springs number and our statewide toll-free number here in Colorado. But anybody in any state in the country, any county in the country has access to this program to get free information and assistance. Tonight, we're going to be talking about Medicare and your options for coverage to go with Medicare. We're going to start with the 3 basic parts of Medicare. But we're going to start with who runs Medicare. How do you get Medicare? Social Security is who determines eligibility for Medicare. And that eligibility is determined by paying taxes through employment, payroll taxes. Social Security processes your actual Medicare enrollment, so that's who you have to contact to enroll in Medicare. They provide your Medicare ID card. They are available pretty much from 7 a.m. to 7 p.m. 5 days a week through their national toll-free number, but we also have a local Social Security office here in Colorado Springs. Once you're enrolled in Medicare, Social Security wants nothing to do with it. So they're only going to be in charge of enrolling you in Medicare and determining if you're eligible to enroll in Medicare. Once you have Medicare, any questions or concerns you have, you would go directly to Medicare or the Centers for Medicare and Medicaid Services. They are the ones who administer the Medicare program. They pay the providers. They determine what benefits are going to be covered. They process all the claims. They do all the policing and all the hand slapping when someone's doing something wrong. Medicare does not have a brick and mortar location. You can only contact them by the toll-free nationwide number, which is basically 1-800-Medicare. Or if you go online to their website, medicare.gov, they now have a chat feature where you can talk to someone. Again, that's 24/7, 365 days a year. You can reach someone at Medicare. You can have Medicare. To be eligible for Medicare, basically you have to be a U.S. citizen and turn 65. Medicare eligibility age is still age 65. And again, that's based on your contributions into the Social Security system through payroll taxes, either your own or spouse's. You can receive Medicare at any age if you have been determined to be disabled by Social Security, or if you are receiving dialysis based on end-stage renal disease, if you've been diagnosed with ALS or Lou Gehrig's disease, and then any resident alien, lawfully admitted resident alien who's resided in this country for at least 5 years, consecutive years, and is turning 65 is also eligible to purchase Medicare. Once you become eligible for Medicare, there are enrollment periods you do need to be aware of. The initial enrollment period, which is what most people are going to have to be most aware of, is the enrollment period that surrounds turning 65, aging into Medicare. That initial enrollment window to enroll in Medicare based on turning 65 is a 7-month window, and it's the 3 months prior to the month of your 65th birthday, the month of, and up to 3 months after the month of your 65th birthday. If you enroll during those months, if you enroll during the 3 months prior to your birthday, your Medicare goes into effect the month of your birthday. If you enroll the month of or any of the 3 months after, it goes into effect the next month. There are other times you could potentially enroll if you do not enroll during that 7-month window on your birthday. There are special enrollment periods based on not enrolling at 65 because you're still working and have employer group coverage. If you are still working based on having employer group coverage, you can delay enrollment into Medicare without penalty because you have what they call creditable coverage, active employer group health coverage, and that can cover you and or your dependent spouse. If you delay enrollment into Medicare because you are working, when you stop working, you have up to 8 months to enroll in Medicare from the time your employment ends. So you get an extra long window of time based on that delay, based on employment. If for some reason you don't enroll during your initial enrollment window surrounding your 65th birthday, you don't enroll after you stop working, if that was the delay, you still have an opportunity to enroll every year during the annual enrollment period or the general enrollment period. That's January 1st through March 31st each year. Your coverage would begin the first day of the month following the month you enroll. But if you are enrolling during the general enrollment period, the annual enrollment period, you're likely going to incur penalties because you didn't enroll during your initial enrollment or had a special enrollment based on employment. And we'll talk about the penalties a little bit more in a minute. This is what the Medicare card looks like. I call it the red, white, and blue card. It's simply going to have your name. It's going to have your Medicare ID number, which these days is simply a series of letters and digits, random series of numbers and digits as an ID number, and it's going to indicate when your Part A and Part B go into effect. You no longer have to sign it or anything like that. After this presentation, if you registered by email, you will be getting a copy of the slides for today's presentation, as well as several of the handouts that I'm going to be referring to throughout the presentation. This is one of the handouts. It's a handout from Social Security, and it kind of just gives you an overview of all the different kinds of things you can do on the Social Security website. Social Security is pushing more and more for things to be done online through their secure website. If you tried to get a hold of Social Security recently, you probably understand why. Medicare.gov also has secure personalized account that you can create. I'm also going to send you a handout on how to do that. So you can create a personalized account at Social Security or SSA.gov, and you can create a personalized account once you're enrolled in Medicare at Medicare.gov. Both are very secure and they can be very handy to have. They're not required at this time. So let's get into Medicare itself. We're going to start with covering what Medicare Part A and Part B costs and what they cover. And we're going to start with Part A. Things to take into consideration is, do you even need to enroll in Part A? Again, if you're turning 65 and you're still actively employed and have employer group health insurance through that employment, you could delay enrollment into any part of Medicare based on that employment. And you can make that delay until you stop working. And then you have that 8-month window once you stop working to actually enroll in Medicare without penalty. A lot of people, when they turn 65, if they're still working, will go ahead and enroll in Part A. Medicare Part A, for most people, does not cost anything. It's a benefit that we earn so that at retirement we have no cost. If you're not covered by employer health coverage through active employment, and it has to be active employment, not retirement health benefits. If you're not covered by that active employment and you turn 65, you should probably enroll in Medicare, because otherwise you will incur penalties if you enroll later down the road. Social Security only accepts the fact that someone is actively employed and has employer group coverage as the excuse for not enrolling at Medicare at 65. That's basically the only excuse they will accept, not to penalize you for not enrolling in Medicare at 65. So keep that in mind. So if you're not actively employed, but you simply don't feel that you need to enroll in Medicare, or you want to keep some other type of coverage you might have, keep in mind that there will be penalties if you choose to enroll in Medicare in the future. Again, Part A for most people is at no cost because you paid into the tax system. You paid Social Security tax and you paid Medicare tax through your employment over your work history. In order to be entitled to Part A at no cost, you simply have to accumulate a total of 10 years of work history. Whether you do that straight out of high school, whether you do that after you got married and raised kids for 20 years, doesn't matter. As soon as you have a total of 10 years accumulated of work history paid into that system, you have earned Part A at no cost when you turn 65. If for some reason you don't accumulate that 10 years of work history, because say you were a stay-at-home parent for all your life after high school or whatever, you can purchase Medicare Part A, but Part A is not cheap. Premium for 2024 is as high as $505 per month if you have to purchase it. So that 10 years is the equivalent of 40 work quarters is how they calculate it as Social Security. And that's quarter years. So every 3 months you accumulate a quarter towards that 10 years of credit. Premiums can be lower if you have 30 or more credits, higher if you have 30 or less. If you have been a stay-at-home parent or don't have that work history, but you have a spouse that has that work history, you could still potentially get Part A at no cost based on that spouse's work history. So keep in mind as well. Once you have Part A, what does it cover? Medicare Part A is basically going to cover any inpatient medical needs you have. So Part A primarily is going to cover inpatient hospitalizations. For inpatient hospital stays, Medicare Part A will cover all costs, whether you're in there for 5 days or 50 days. Medicare Part A covers all inpatient hospital costs except for a deductible. This year, that deductible per admission is $1,632. If you have multiple admissions within a year, you could have multiple deductibles of $1,632. And that amount does increase each year. That covers you up to 60 consecutive days in the hospital. If you're there longer than 60 consecutive days, Medicare will continue to pay, but they will start paying less, and they will start applying a $408 per day coinsurance, meaning they're going to pay everything except for $408 a day. And if you're there longer than 90 consecutive days, that goes up to $816. Medicare does not put a limit on how long you can be in the hospital and how long they'll pay, what they'll pay. But they do have time frames that they call benefit periods. So if you're in the hospital for 5 days and then you're discharged home, and then the next year you have to go back into the hospital for 10 days, when you have each hospital stay, you start a new benefit period. It's when you start a new benefit period that you have to worry about that $1,630 deductible per admission. That same deductible does apply for inpatient psychiatric hospital stays, but Medicare does put a maximum lifetime amount of days that they will cover inpatient psychiatric at 190. There are some things Medicare will not pay while you're inpatient. That's a private room unless it's deemed medically necessary. Medicare does not cover under any part any of the first 3 pints of replacement blood someone might need. Don't ask me why. They've never given me a straight answer. They don't cover private duty nurses or room sitters while you're in the hospital, and they do not cover what they consider self-administered drugs, which basically, while you're in the hospital as an inpatient, all your medications, any services, surgeries, treatments, whatever, are going to be covered under Part A, minus that deductible. But on the day of discharge, when they're discharging you from the hospital, you're no longer considered inpatient. If they're taking forever and a day to get you discharged and it comes time for you to get your maintenance medications or something, and they come in and give you your high blood pressure medication for the day because you're still not out of there, keep in mind that that would be considered a self-administered drug. And you'd have to look at getting reimbursed from your P plan for that cost. The other benefits covered under Part A are going to be skilled nursing facilities, basically inpatient rehab. after a hospital stay. If you have an inpatient hospital stay of 3 days or more, and then the doctor discharges you to an inpatient skilled facility for rehab or recovery, Medicare will pay 100% for that inpatient rehab or recovery for the first 20 days. From day 21 up to day 100 of that inpatient rehab stay, Medicare will continue to pay everything except for $204 per day. So the first 20 days of an inpatient rehab stay are covered at 100%. Starting at day 21, Medicare pays everything except for $204 a day, up to a maximum of 100 days at a time. Medicare will give you those 100 days at a time as often as you need them. But if you have say a 2-week rehab stay this year, and then next year you have a 3-week rehab stay because you broke another part of your body, when you go back in the second time, you're starting a new 100-day benefit period. And so that first 20 days is covered at 100%, starts over. But you get an unlimited amount of those benefit periods throughout the rest of your lifetime. If for some reason you're still in an inpatient rehab facility, after 100 days, starting at day 101, Medicare no longer cares why you're there. They will cut off coverage completely, and that will become a private pay stay. You'll have to pay out of pocket. And that's basically because Medicare has determined that if you have not gotten well enough to go home, even if it's to go home with continued care at home, like continued in-home rehab or whatever, if you've not gotten well enough to be able to go home, you're likely not going to be able to go home after 100 days. And then it becomes custodial or long-term care. The last benefits covered under Part A are home health care and hospice. Both those benefits do require a doctor's certification to confirm your eligibility based on medical need. Usually these services are going to be covered at 100%, and there is no limit to how long you can receive in-home health care or hospice care. There are some limits on some services, but for the most part, whatever you need, especially under hospice to make you comfortable at an end-of-life situation, all of that's covered by Medicare at 100%. In-home health care has to be medically necessary, and the doctor has to certify that you are able to continue, say, in-home rehab safely, and it is continuing to improve your health. I'm sorry, DME, durable medical equipment. That's going to be your oxygen concentrators, walkers, wheelchairs, in-home hospital beds, that kind of thing. And that's billed under Part B of Medicare for that specific equipment, which is why there would be only 80% coverage. So that's Part A in a nutshell. Medicare Part B, basically, this is the part of Medicare that most people have to pay for. Again, take into consideration if you're still actively employed with employer group health coverage covering you and or your spouse, you can delay enrollment into Medicare Part B without penalty. And when that employment ends, you have that 8-month window to enroll without penalty. If you are already collecting Social Security income, say you started collecting at early retirement age of 62 or anytime between 62 and 66 and some months is whatever full retirement age is now. If you're collecting Social Security for any reason, when you become eligible for Medicare at 65, keep in mind they will automatically enroll you in Medicare. It won't be a choice. They will just do it because you're collecting Social Security. That also applies to people who are eligible for Medicare based on disability. If you don't want them to enroll you, you do have to contact them when you get the card in the mail and say, I don't want it, I don't need it, I have employer coverage or what have you. But again, employer coverage through active employment would be the only reason they would accept that you are going to reject Medicare automatically and enroll in the future. Again, active employment is going to be the only excuse Social Security accepts for delayed enrollment into any part of Medicare, but you do get that 8-month window if that is the reasoning for a delay. once that employment ends. And then you have the general annual enrollment period if you don't enroll during your initial enrollment, or a special enrollment based on income or employment. But if you are enrolling during a general enrollment period because you missed the other two opportunities, you will be penalized on what you pay for Medicare B. The premium for Medicare Part B in 2024, $174.90 per month per person. That amount is typically automatically deducted from your Social Security income each month. If you're not collecting a Social Security income, but you go ahead and enroll, Medicare and Social Security will bill you that monthly premium until you start collecting a Social Security income, and then they will start automatically deducting it. There is no choice about that. Once you start collecting a Social Security income, they will deduct it automatically from that income. If for some reason you are going to be penalized because you didn't enroll during your initial enrollment, you didn't fall under a special enrollment based on employment, the penalty is 10% of the Part B premium for every full 12-month period you delayed.
Annual
We're going to talk about that in the next slide. So the penalty, 10% of the Part B premium for every year you delay. So if you delay enrollment for 3 years, that 10% is accumulating. So after 3 years, it's a 30% penalty multiplied by whatever the premium is 3 years from now. Whatever that comes out to is going to be tacked on top of that premium every month for the rest of your life.
I have 39 credits, but I get para retirement.
And para is a totally different situation. You guys
Get para.
you guys fall under some different rules, and we'd be more than happy to sit down and talk to you about those options and how all of that works one-on-one with you if you'd like.
Thank you.
So yeah, if you incur a penalty on paying anything for Medicare, that is a lifetime penalty that goes away. Once it's set in stone. So whatever that 30% comes out to is going to be tacked on to your Part B premium, whatever that changes to each year. Part B premiums and Part D for drug premiums are means tested now, meaning if you have a higher income, you may pay a higher Part B premium based solely on that income. It's called the IRMA. Income would have to be for an individual $103 annually or $206 for a married couple before you have to worry about paying that higher premium. There are different levels, different premiums based on different incomes. What they're going to look at is the most recent complete IRS income tax filing they can look at, which is typically going to be for like 2 years ago. So if you're looking at paying a higher premium based on higher income in 2024, it's because they're looking at your income in 2022.
And they'll look at our joint tax return.
So yes, anybody who is married and files taxes jointly, even if you're only becoming eligible and she is not, she's still employed, they are still going to look at that for your premium individually. Yep. But again, it's going to be based on old information, 2022 information for 2024. Now, if your income goes down once you do retire, that higher premium will also go away. So if you had a really significant income in 2022, you retire in 2024, and your income goes down 40%, when they see your income tax filings for 2024, they will reduce the premium based on that information. So they're going to look at this every year and adjust it only. Part B also has a deductible. The Part B deductible is a drop in the bucket, $240 per year. Whereas the Part A deductible is applied per hospital admission. This is applied one time a year, $240 for 2024. For Part B services, Medicare typically will pay for those services at an 80-20 split. So you have to pay the first $240 each year, and then Medicare pays 80% for Part B services. Whereas Part A is going to primarily cover inpatient services, Part B is going to cover all of the outpatient services, which will include office visits of any kind, primary or specialist, all your x-rays and lab work, all your medical, surgical, and anesthesia services. Medicare also does pay for medical second opinions. Medicare Part B will start paying for replacement blood at pint number 4. Again, no part of Medicare covers the first 3 pints, covers your ambulance for emergency transport, your annual vaccines, all your outpatient physical, occupational, and speech therapies, the durable medical equipment. Again, that's the oxygen, the wheelchairs, the walkers. And there is limited coverage for services for chiropractic, podiatry, and optometry.
The information that's showing up on all these slides, is that going to be in these books, or where are we going to be able to get to?
The Medicare and You handbook has all of this information in it, maybe not as easily accessible. You may have to read the whole booklet to get all of the information, but we will also email a copy of these slides to anybody who registered with an email. And again, we're also going to include the handouts that I refer to. But everything that I'm talking about is in the Medicare and You handbooks. Medicare also covers preventive services at 100%. There is a huge, huge list of services that Medicare considers preventive and will pay for at 100%. That list of services is provided in the Medicare and You handbook each year. If you have not gotten a hard copy of that handbook mailed to you because you're not yet on Medicare, once you're on Medicare, Medicare will mail you a hard copy of a Medicare and You handbook every year. Otherwise, you can go to the Medicare.gov website and access it electronically in PDF form and get the full list of all preventives that Medicare will cover. And we do have the 2025 Medicare and You handbooks on the side table there as well. So basically, that is Medicare A and B in a nutshell. Part A covers inpatient, Part B covers outpatient. Most people will not pay for Part A. Everybody pays a premium for Part B. Once you're enrolled in Medicare A and B, you do have a couple of options for insurance to go with your A and B. The 2 options are either going to be a Medicare supplement, also known as Medigap, or a Medicare Advantage plan, which is what you see advertised on TV, in your text messages, in your emails, telemarketing calls. Every time you turn around, you're getting advertising for Advantage plans. Medicare supplement or Medigap coverage is a different kind of insurance, but this is one of your 2 options, and this is available for anybody who becomes enrolled in Medicare. Medicare supplement or Medigap is basically a private insurance policy that you purchase from a private insurance company, and it is solely and specifically designed to pay the balance that Medicare Part A and Part B leave over after they pay their part first, period. That is specifically what it is designed to do. It does have to follow federal and state laws in compliance with Medicare. It must say Medicare supplement insurance on the policy itself to be legitimate. The phrase Medigap comes from the thought process that it covers the gaps in your Medicare benefits, basically the costs that Medicare leave over. There are different levels of coverage that you can choose to purchase as this kind of coverage. There's basically 10 different levels. They're labeled by alphabet, A through N. 3 states have a couple of other options for coverage that we're not going to talk about because we don't live in those states. Costs do vary for this kind of coverage based on the companies, based on the levels of coverage that you choose to purchase, based on your zip code, based on whether you're male or female. So it's kind of like buying car insurance. They're going to have a lot of different factors that will determine what you pay for this kind of coverage. The bottom line is this kind of coverage to go with your Medicare will only pay what Medicare left over after Medicare paid first. If Medicare does not pay for something, this coverage will not pay for it either. It's only going to pick up what Medicare left over. So it works when you have original A and B of Medicare as your primary insurance, a Medigap becomes your secondary insurance. But between Medicare A and B and a Medigap policy, you could potentially have almost 100% medical coverage. If you have other options, if you're a para retiree, a federal civil service retiree, have health benefits available through an employer when you retire. If you're military, retired military, or a veteran, you may not need to look at this other option or an advantage plan because you have those retirement options. If you go with this option, again, Medicare A and B is your primary insurance. Medicare A and B is good anywhere in this country for any medical need with almost any provider. It's one of the most commonly accepted insurances anywhere in the country. Again, as long as Medicare pays their part first, the Medigap policy would pay the balance no matter where you're at or what you need. And the key to Medicare coverage is going to be what you need. Was it medically necessary? As long as Medicare pays their part, the supplement Medigap will pay the balance. And because it's everywhere, it is the most portable. So if people plan to travel in retirement, if you snowbird between one state and another, between the seasons, this travels very well because it's good everywhere. There, yes.
So you were alluding to for military or veterans, the TRICARE for life, the bill is gap.
People who have who are retired military, have put your 20 years in and are eligible for TRICARE for life when you get Medicare. Absolutely. Medicare and TRICARE for life is honestly the best combination of coverage you can have in this country today. And you don't need anything else.
You mentioned in this country. So what happens if you go to foreign country for a
Medicare does not cross the border or boundaries of the United States and or our territories except in limited situations at the Canadian or Mexican border. So once you leave the country, your coverage stays in the country. And if you plan on traveling outside of the country, I encourage you to look at travel insurance. Yep,
don't some of the Medigap plans have coverage for?
they have reimbursement
Okay, they have
in a medical emergency. And certainly that is what the SHIP program can help you guys understand. By sitting down one-on-one with a counselor, we can help you understand all the specifics of how these coverages coordinate or don't coordinate with Medicare and all those kind of details. Because a Medigap policy does not cover anything that Medicare does not cover, but they can offer reimbursement if you travel outside of the country in a medical emergency. There are some better times to purchase this kind of coverage. When you first get enrolled in both A and B of Medicare, Medicare provides you a 6-month window to be guaranteed issue into this kind of coverage. What that means is outside of this 6-month window, you try and purchase this coverage, you would be subject to underwriting. What that means is they would look at your health history, and if they did not like what they see, the insurance companies would not have to sell you insurance, this kind of insurance. But if you purchase it within the first 6 months of your A and B being in effect, they cannot do that. You're guaranteed to get whatever policy you want from whatever company you want with no questions asked. They cannot turn you down. For people with pre-existing conditions, that could be very, very important. If you're healthy and could pass underwriting, you can purchase this kind of coverage whenever you want. Because you're going to pass underwriting, they'll be happy to sell it to you. But if you have pre-existing conditions, this is a very important window to be aware of. If you have coverage, retire, say you have an employer plan providing coverage to go with your Medicare after you retire, but a couple years down the road, the employer decides they don't want to fund that anymore and they cut you off from that retirement benefit, because that would be considered involuntary loss of coverage. It would also provide you a limited window of guarantee issue into this kind of coverage, a Medigap policy, based on that involuntary loss of other coverage. Medicare does not ever want to leave you in a situation where you're uninsured and uninsurable through no fault of your own. So they will always provide you an opportunity to get into something to go with your Medicare based on an involuntary loss scenario. That also applies to Advantage plans for people who are just enrolling in Medicare, and we'll talk about that a little bit more in a couple of minutes. Going to include some hand. We send all of this information to you after the presentation by email. This is a chart that details the 10 different levels of coverage that you can purchase as a Medigap. And then it's put out by the state that gives you information about all the plans licensed to sell this coverage in Colorado, tells you what the plans charge for each level of coverage that they offer. Again, if you want more detailed information, we're happy to sit down with you one-on-one or talk to you over the phone one-on-one to give you more specifics, but these handouts will be sent to you by email. So that is one option of coverage to go with Medicare. The other option are going to be Advantage plans, and the Advantage plans are what we see advertised everywhere. It is an entirely different animal of coverage, works entirely differently than a Medigap. Medicare Advantage plans are basically private insurance companies that have contracted directly with Medicare. And once you enroll in one of these Advantage plans that have contracted with Medicare, that plan becomes your Medicare. Medicare is going to pay them to provide all the Medicare covered services for them. So you don't have original Medicare A and B and an Advantage plan. You have original A and B being replaced by the Advantage plan. A and B do not go away. They're always there in the background. But once you enroll in an Advantage plan, that plan manages those benefits for you. And you have to follow all of that plan's rules. That's why sometimes it's referred to as a replacement plan. But you still have all the rights and protections of original Medicare. Medicare still regulates everything that these plans can and cannot do. They're called Advantage plans because they tend to come with extra benefits that Medicare does not typically cover. Gym memberships, dental, vision, those kinds of things. Those are the things that are most advertised. Most Advantage plans also include Medicare Part D drug coverage. If you have original Medicare and a Medigap, you have to purchase a Part D drug plan in addition to that. But Advantage plans will typically include it at no extra cost. There's some additional eligibility requirements to enroll in an Advantage plan. You can only enroll in an Advantage plan that's available in your county of residence. And plans vary from county to county in every state. You can only enroll during certain eligibility periods. That would include just your eligibility surrounding enrollment into Medicare for the first time, your initial enrollment. It includes annual enrollment periods. We're going to talk about all of that. So enrollment period is the same enrollment period to enroll in Medicare, that 7-month window surrounding that 65th birthday. If you're enrolling in Medicare during that period, you can also enroll in an Advantage plan if you choose to do so, and it will go into effect when Medicare kicks in. But there are additional enrollment periods that you can take advantage of if you look at this as an option. There's the annual election period, what we typically just generally refer to as open enrollment, which is coming up in 2 weeks, October 15th through December 7th. Then Medicare recently added the annual Medicare Advantage plan open enrollment in addition to the open enrollment period just for people in Advantage plans. That's January 1st through March 31st. And then special enrollment periods are always available in situations where you're losing other coverage through no fault of your own. So Medicare, again, will always find a way to make sure that you're not in a situation where you're uninsured or insurable through no fault of your own. So the annual election period, just referred to as open enrollment, October 15th through December 7th every year. During this time frame, you have an opportunity to get into, get out of, or switch from one Medicare Part D standalone drug plan or Medicare Advantage plan with no restrictions. You can switch willy-nilly. Any change you make during this window goes into effect January 1st the next year. The new enrollment period for Medicare Advantage plan is if you are enrolled in a Medicare Advantage plan on January 1st of any year, you get another 3-month window, January 1st through March 31st, to decide if you want to drop the Advantage plan you enrolled in for January, or switch to a different Advantage plan that you enrolled in for January without restriction. Any change you make goes into effect the first of the next month. It only applies to people who are enrolled in an Advantage plan on January 1st. If you're not enrolled in an Advantage plan on January 1st, this enrollment period does not apply to you. You can't do anything. And then again, special enrollment periods are situations where you have lost other coverage through no fault of your own. Because you can only purchase an Advantage plan in the county that you reside in, if you move from one area to another area, you cannot take your Advantage plan with you. When you get to the new area that you're moving to, you would have an opportunity to enroll in whatever Advantage plans are available in that new area. Or you would also have an opportunity to have a window of guarantee issue into a Medigap. Because you couldn't take the plan with you when you moved, that is considered involuntary loss of coverage, and it would provide a guarantee into a Medigap if you want to take advantage of that. But because you cannot take it with you, it has to stay behind, and you have to find something else when you get to where you're going. The other way that can work is because Medicare Advantage plans are confusing, because there is so much marketing and advertising and information out there that is confusing, misleading, misunderstood. Medicare has created a test drive opportunity for people who want to try Advantage plans to see if they're going to work for them. Medicare will provide people who are just becoming enrolled in Medicare a 12-month window of opportunity to enroll in an Advantage plan to decide if it's going to be the kind of insurance that is going to work for you. If within any point during that 12 months you decide Medicare Advantage plans are not for you, you would be able to drop that plan and still have guarantee into a Medigap even if it's past the initial 6-month guarantee issue window. You get to use this test drive once. So it's an opportunity to test drive this kind of coverage when you first become enrolled in Medicare at 65. If you delay enrollment into Medicare because you worked, you lose this test drive opportunity, unfortunately. But it does provide you an opportunity to try it out. And I don't discourage people from doing that. Advantage plans can work very, very well for some people and not so much for others, just like anything else. In an Advantage plan, even if that plan has no monthly premium, you still have to pay for Part B. No matter what you decide to do with other coverage, you still always have to pay that Part B premium. Some Advantage plans may have a premium. Most in our area are zero, so there's no extra cost to enroll in them. But the way they cover you is entirely different. Whereas Medicare and a Medigap pay everything, Medicare pays their part, the Medigap pays the balance. With Advantage plans, you pay copays every time you walk into the door for a service. So you go to the doctor, you have a copay. You go to the emergency room, you have a copay. You go to outpatient therapy, you have a copay. So in exchange for that little or no monthly premium, you do have some out-of-pocket costs as you use services. These plans could also have deductibles for pharmacy or medical services. Most of them don't, but some of them are starting to add those deductibles as well. Again, you will get all of your Medicare covered services, even in an Advantage plan, because this plan, Medicare is paying this plan to provide anything that Medicare would provide. So they have to provide any service that Medicare would pay for. Most plans will include drug coverage. Most Advantage plans are going to limit you to what doctors you can see or what facilities you could use. There are many, many different kinds of Advantage plans, including HMOs and PPOs and fee-for-service and on and on and on. And they keep adding designations to these plans to make them just a little bit more confusing each year. But there's a lot of different things to choose from. But most of them are going to have providers that they contract with directly that they're going to want you to use. And even if you aren't required to use those providers, keep in mind that if you go out of network, even if it's allowed, you will usually pay a higher copay. And you are usually going to be limited to getting services in the county you reside in. That is the service area of that plan. If you go out of that county for services, You're either going to pay a higher cost, you may have to ask for permission, or you may have no coverage at all outside of that service area. And that depends on what kind of plan you have.
And it's true that if you're in a different county, not all counties covers the Advantage plan.
There are different plans available in different counties. Yep. So just because a plan is available in El Paso, Park and Teller does not mean that same plan would be available in Fremont County. So it does vary from county to county. And for the most part, again, you need to get services in the county that you purchase that plan in, the county you live in. But some plans do allow you to go outside of that county or that service area to receive medical services. It just depends on the type of plan you get. So again, you got HMOs, you got PPOs, you got special needs plans, PACE plans. Medicare has created Medicare savings accounts, although none are available for purchase in Colorado at this time. If you get a Medicare and You handbook for 2025, specific to Colorado, and it will say on the back of the book if it's specific to Colorado, the ones we have here are, it will list all of the plans available in Colorado, both Advantage plans and Part D drug plans, and what areas they're available in. Or you can go to the Medicare.gov website, or you can call 1-800-Medicare and talk to a representative, and they'll be happy to talk to you about what's available in your area. Again, you still have all the rights and protections of original Medicare in these plans. You have some additional rights, which include access to providers. These plans must provide you with contracted providers in the service area that you purchased it in. You have the right to know how they get paid. You have the right to efficient and timely appeal processes and expedited appeal processes in some situations. You have the right to get whatever services you need. You have the right to receive information about that plan in easy to understand language. And of course, you have the right to have your medical information kept private. So a couple of things you ask yourself if you're looking at Advantage plans as your option or direction you want to go in when you get Medicare. It's always make sure that these plans are going to cover your prescriptions. Every plan available, and there are going to be over 40 plans available for Advantage plans in El Paso County alone. Make sure the plan that you're looking at specifically covers your specific prescriptions. Make sure you know whether or not you have to choose a primary care provider or if you can just go to your regular doctor. Don't ask the plan, ask your doctor if they take the plan that you're looking at. If you're looking at the supplemental benefits, the dental, the vision, the gym memberships, the transportation, the meals, whatever benefits, whatever cherries on top of the cake they're offering, make sure you ask them how to access those benefits. That is the number one complaint we've gotten this year is people are getting these plans because of these supplemental benefits. They're using these benefits, but they're not asking how to use them, and they're not being covered because they're not going through the process that they were required to use. And then anything else that's important to you about your medical care and your medical needs. Be sure to ask lots of questions and get answers. Don't let them just kind of sideline you. Make sure you get answers. And if they can't answer the question, make sure they find out and get back to you. Before you sign on the dotted line, make sure you understand what you're enrolling in and how that benefit and how that plan works. Going to include a couple of additional handouts when we email all of this stuff to you. This is a handout that's basically going to give you much more detail about each type of Advantage plan. It's going to tell you how it works. It's going to give you some pros and cons for each type of Advantage plan. Very handy handout to have. This is put out by the Division of Insurance up in Denver, specifically to help with understanding these kinds of coverages.
You have Medicare Advantage, you go out of state and you get stuck over there and end up at the hospital. Will they cover you on it?
Medicare Advantage plans have to cover you no matter where you're at in a medical emergency. So you can be anywhere in the country and have a medical emergency and they would have to pay for that. But outside of a medical emergency, if you go out of network, if you have an Advantage plan that requires the network, you could potentially not have coverage. But in an emergency, you're covered no matter what.
So do they have a definition of what emergencies are? For example, if you're traveling across to another state and your back goes out and you need to see a chiropractor to get adjustment, is that considered an emergency or not?
That's up to interpretation for each plan.
Yeah.
In that situation, I would call the plan first. And when in doubt, that's my best advice is call the plan first, if possible. If it's a true emergency, you're not going to have time to call the plan, is a good rule of thumb. Same thing, outside of your service area or your county of residence. You could be out of network, depending on the type.
But it's gotta be.
It's got to be a medical emergency for them to cover it without question. Yep.
And I have a question. Are medical providers like doctors and hospitals, emergency clinics, do they pretty much commit long-term, this is what we're going to cover in Medicare? Whereas, Medicare may decide every so many years, oh, we're not going to have that doctor as one.
No, the way that works is if a provider decides to accept a patient that has original Medicare A and B, that doctor has to bill for any services that Medicare would pay for that they provide that was medically necessary. With an Advantage plans contract with doctors and providers on an annual basis.
Annual basis.
Annual. So doctor could be a contracted provider 1 year and not the next. But once someone decides to take original Medicare, that's not a annual contracting basis. Once they're in until they choose to get out.
Do I understand that with the Medicare plans, a doctor can opt out anytime during the year? They don't have they may sign a contract, but it's my understanding they can opt out anytime during the year.
Technically, yes. Theoretically, that's not supposed to happen. And even if it does, there's supposed to be 60-day minimum notice to all the patients if the doctor chooses to do that.
And Romo, we also got a question from Steve in the chat. What is the process of obtaining a doctor's certification for in-home care? Is there specific paperwork required?
Yes. It may be different paperwork if you're an Advantage plan versus having original Medicare, but basically it's going to be called a certificate of medical necessity that the doctor has to fill out. He just answers some questions, provides some medical information about your diagnosis and prognosis, and that determines whether or not you are eligible, you meet the criteria for Medicare to pay for in-home care, whether it's physical therapy or wound care or whatever the need was, but it has to be a medical need in order for that to be paid for.
And then another question from Krista. What determines benefits period referred to in Part A slides?
A benefit period is for Part A hospital coverage. Benefit period is typically going to be a 90-day window. In order to start a new benefit period, if you're admitted to the hospital for, say, 5 days, then you're discharged. If you're discharged and you're out of the hospital for 60 days or longer, and then you have to go back into the hospital as an inpatient, if there's more than 60 days between discharge and readmission, you start a new benefit period. If there's less than 60 days between discharge and readmission, when you go back in the second time, you could still be in the same benefit period, the initial 90 days. On the plus side, that means you wouldn't have to pay the deductible the second time. But the clock is still ticking on the initial first 5 days. That it? I know we're about out of time, so the last thing I want to talk about real quick, there is financial assistance programs available to help people with the costs of Medicare Part B and Part D, which we didn't get to. But I'll provide you some information about how you can get more information about Part D. Medicare savings programs are a federal financial assistance program specifically designed to help people when you have limited or low income, pay the Medicare Part B premium. Income limits for 2024 listed on the slide. All of these income limits would cover the Part B premium so that Social Security would not be deducting that from your income or you would not be paying them monthly. the state of Colorado would pay that for you. There are asset limits for that assistance as well for a couple, married couple or an individual. The income limits are in gross dollars, pre-deduction dollars. So it's not what you bring home after taxes, it's what you get before taxes is what they're going to look at. But if you qualify at the SLMB or QI, the state will pay your Part B premium. That saves you $175 a month. If you qualify at the lowest income and asset level, Q and B, the state will not only pay your Part B premium, but would also pay any deductible or 20% balance after Medicare A or B paid their part first. It would basically act like a Medigap policy at no cost. But you do have to be within those income and asset limits. We do help with those applications. If anybody wants more information, we're happy to talk to you. And I know we're pushing the 5 o'clock time frame. I'll take one more question.
If you're not drawing Social Security yet, but you get on Medicare, how do they deduct the premium? How does?
So if you're not collecting Social Security so that they can deduct that premium from it, they will bill you. And they're going to bill you usually in 3-month increments. Once you pay that first 3-month bill, you can arrange through the Medicare.gov website to have it electronically deducted from a bank account every month after that. And that's usually the way I encourage people to do it because that 3-month billing process is kind of a mess. They always send you the bill. By the time you get it, it's due the next week and it takes 6 weeks to process. So
when you sign up, it's the $174 times 3 is what you're saying we pay.
that first bill, if you're not collecting Social Security for them to take it out of, yep. And what they're going to look at is the first 3 months, but if your birthday is in February, they're going to bill you for February, March, and then the next quarter, April, May, and June. So that first bill may be a 5-month bill. Yep. So it's a messy process.
I apologize because I was writing when you said that. You said that they're going to bill. You said what part gets messy? How to handle it?
So if you're not collecting it so they can take it out of Social Security, when they bill you, it's going to be a paper bill through the mail. If your benefits start in February, you're in the middle of a quarter year, they're going to bill you for February, March, and then the next quarter, April, May, and June. So the first bill may be for 5 months.
So if your birthday is in March, they're only gonna bill you for March.
They're going to bill you for March and then April, May, and June.
April, May.
Yep. They're always going to try and bill you in advance, as far in advance as they can.
Folks, we
But-
can stay and talk a little bit longer for Q&A if you would like, but we wanted to give people the option to leave at 5 o'clock. You're welcome to do that. I'm not tied down. I know a lot of you have different obligations, but we can stay a little bit longer for Q&A if you would like to do that. So we just wanted to let you know.
Yeah, I'm happy to stay for any additional questions. Again, as a reminder, if anybody is interested in sitting down with a counselor one-on-one to talk about your specific situation and your options, we're happy to do that. Simply give us a call. And we're happy to schedule an appointment with you by phone, in person, video chat, however it works best for you. Typically, I do a Medicare 101 because there is so much information to cover. I've started breaking it up into 4 different sessions over a 4-week period to get into more detail about the different parts. I only did that once this year, but we did record them. And so I'm going to ask Jared to post those recordings to our website in the next week or so. Hopefully he'll be able to get that done for us. And so if you guys are interested in more in-depth presentation, those recordings will be available soon. And definitely a lot more detailed information about all of these benefits. And because we didn't get to Medicare Part D today, the third presentation is all about just Part D. But we are also available during open enrollment for anybody who is interested, whether you're eligible for Medicare in the next 3 months or not. We're always happy to sit down and talk to you about what your options are and what your situation is and what might work best for you. So give us a call, shoot us an email. You can email me. And we'll get an appointment scheduled to come in and see somebody.
Thank
Tell me a
you.
little bit more about paramedical Medicare Advantage.
I'm sorry about what?
Medicare Advantage through parents.
So PAIR is a very unique situation. It's a very unique retirement benefit. And again, we'd be happy to sit down and talk to you about it because it works. It's technically an advantage plan, but it's not.
Are you talking Paracare?
Paracare, yeah, for para-retirees.
Yeah.
So it's not a quick and simple answer. It's not like a 5-minute answer because it is an advantage plan, but it's not. Para has done well by you guys still.
Yeah.
They offer you good benefits, but they're not going to work like the benefits we just talked about. They're going to be a little better.
State pay at the income level on Medicare Advantage too for Part B on Medicare Advantage.
If you qualify for the financial assistance, it doesn't matter what you enroll in. They're still going to provide that assistance. And then you can choose to do what you want regardless.
What if you have,
Yeah. Sorry.
what if you have Medicare and then Medicaid for the, what is it called, working something?
Working adults with disabilities.
Yes.
Okay, so people can have both Medicare and still qualify for Medicaid. And in that situation, Medicare is still going to be the primary insurance and Medicaid will act more or less like a Medigap, but at no cost. You would still have to enroll in a separate Part D plan, but that would also be at no cost because you
Okay.
qualify for the Medicaid. So you can have both, and it's to your advantage to have both. And if you want to sit down with someone to better understand how that works and the differences between the two, we're happy to do that.
Yes, please.
So yeah, just give us a call or shoot us an email and we'll get you an appointment.
Do we have your contact information?
Yes. Our local phone number is on the slide, our statewide number, our email address, seniorinsure@ppac.org. You can call the area agency on aging at the 471-2096, which is on the yellow book. All kinds of ways to reach us, and we're happy to get back with you and get you scheduled.
Okay, I appreciate that because it's.
Yeah,
the more
it's
I
confusing.
learn, the more information confusing it gets.
Yeah,
Yes.
it's a lot.
Thank you.
You're welcome. Are there any other questions I could help you with? Anybody?
We have our final session next week with Dr. Sarah Qualls talking on meaning and purpose. And that will conclude our retirement series for this year. I hope you can make it.
Yeah, she's awesome.
Thank you very much for doing this. I really appreciate it.
Sorry about that. I hope I'll repeat myself. Next week is our final session for the retirement series. We have Dr. Sarah Qualls joining us. She has been with us for several years, and it's not Medicare and it's Social Security. It's a whole different look at what happens next on your life journey. So check it out. It's 4:00. It'll be here, and we thank you so much for joining us. And Laura, thank you for being with us for End Credit Union. And Roma, thank you.